saw the price of a popular insecticide, and I was like, wow. So this is really expensive, and who would be able to afford this?
And it will surprise you that popular, most insecticides these days are not really, they don't have. For me, I
Yes.
don't know, Joyce. Have you done the experiment? I have. I've bought certain very popular insecticide, that used to be very strong those days. But now these days it's just as if you're spraying perfumes on the mosquitoes.
There's a new brand. There's a new brand that's quite effective.
Okay.
After the show, maybe I'll share some.
Oh, please, you should. I think I need one. Okay, at a fee. Okay, so please go on, Olale.
So, as I was saying, that is, and you actually raised a very good point. Yes, when you spray the insecticide, you see these things are not working. Yes, it's just as if the mosquitoes have created, they are resistant to heat already. So, I would say the LLIN is one method we should continue to use. And another thing is there are mass campaign for free mosquito treatment and free mosquito drugs in terms of malaria now, malaria drugs. Yes. So and we have an easy to use kit you can use in testing yourself just to know, okay, if you're infected or you're not infected. And just generally, there's this thing in NTD. There's one of the thematic areas we call WASH. So that's the water sanitation and hygiene promotion. So what it involves generally is you making sure your environment is clean in respect to the water source, in respect to drainage, and yes, in respect to the bushes around you. So those are those things that can foster the quick spread of mosquito.
Now let's talk repellents. Well, I rarely use that because I feel I'm just rubbing something on my skin. I don't know if it's giving me rashes or something. So
exactly.
How safe are repellents, mosquito repellents?
Now, when you talk about repellents, as we have a drug-to-drug interactions, so we have some chemicals in the repellents that could cause like an adverse effect. So like an SAE, that's specific adverse effect in your body. So some people might use it and they get rashes, and some people might use it and they won't. So it's convenient for some people to use repellent compared to insecticide because some get easily irritated. So I wouldn't say it's something you should also throw away. Try heavy means necessary just to avoid
just to keep yourself safe.
So that is the idea.
Okay, so thank you so much, Mr. Oladipupo Olalikon.
Yes,
thank you so much.
Thank you so much
on the show. At least we've been able to connect other diseases with mosquito, not just malaria. Because you tell the layman mosquitoes and he just remembers malaria. And there's this song that back then, mosquito, that's mosquito.
I think
you ever come across it?
Nah.
Are you serious?
Nah.
Oh, okay, just go back and
maybe
is it the one
with popular mosquitoes, and then you see the mosquito
dancing.
Maybe you teach that to me later.
Thank you so much for coming.
Thanks. Okay, so we're not done talking. World Mosquitoes Day. We'll be looking at the connection between a mosquito and not just malaria, but other diseases. So stay with us. The show will continue. See you soon.
Get credible and authentic housing news at your fingertips by downloading the Housing TV mobile app. You can also join the African International Housing Show live from across the globe through the Housing TV mobile app. The mobile app features live streaming and trending housing news. You can locate the AIHS venue via the app, network with AIHS seasoned speakers, and live chat with exhibitors. You can also order house or building materials at AIHS via this app. Download the Housing TV mobile app now from the App Store and Google Play Store. And don't forget to click on the notification button. Available for both iOS and Android users. Housing TV is also on Star Times, channel 149 decoder.
Welcome back from that break. If you're just joining us, this is the Good Morning Africa show on Housing TV Africa. Still in the studio discussing World Malaria Day. We just had a very insightful and educative conversation with Mr. Olalekan Oladipupo. We have another guest with us here today, in person of Mr. Giving Promise. Is also known as the Priest of Africa. Is the country coordinator for the Malaria and MTD's Youth Corps, a youth leadership and engagement specialist coordinating the MNTDs in Nigeria. You're welcome, Mr. Giving.
Thank you so much.
I learned MNTDs is Malaria and Neglected Tropical Diseases Youth Corps.
Yeah, that's the name. Right? Yeah, thank you so much.
Welcome to the studio. So we'll be having a conversation on World Mosquito Day.
Yeah.
Today is actually the day, and we want to create a lot of awareness for the viewers so they know how to prevent themselves properly from mosquito bite. So now let's start off. Why is World Mosquito Day important, and what is the significance in the fight against mosquito-borne diseases?
Okay, thank you so much, Housing TV Africa, for having me in your show.
Welcome.
Good morning, Africa.
Good morning.
So, for the global health issue and concern, malaria happens to be one of the most fatal sicknesses and diseases taking lives of kids from 0 to 5 years, and pregnant mothers too, especially in communities and tropical regions in Africa. So the World Malaria Day was a day set up to basically create awareness about the global effect or the global impact of mosquito in the health of people, especially children and pregnant mothers. Not saying that it's not affecting any other persons, but usually affects children from 0 to 5 and pregnant mothers. Basically, too, for the World Mosquito Day, it's used to enhance community engagements, community partnerships. It's also used to get innovative solutions in trying to stop the vector from reproducing or causing harm in the communities that they find themselves. And also, I think it also creates global partnerships. It helps global partners to see the need that this particular region is going through this menace, and we have a responsibility to support them in their health drive.
Thank you so much for that. Now let's go to orientation, educating the public, society about mosquitoes and the diseases they cause. So let's look at how can public health campaigns and education contribute to reducing the spread of mosquito-borne diseases, rather.
These campaigns help a lot because, as I said, people cannot fight what they don't know. People cannot defend against vectors that they don't really understand, the strategies they come with. So these campaigns help to, first of all, raise the awareness. So people in the community understand where this is coming from and what is causing it. And secondly, it also, when you know these things, it also helps us to save our lives and reduces our behaviors that we keep that breeds them. So these campaigns, as it continues, behaviors are changed, lives are saved, and the communities are healthy.
Thank you so much, Mr. Giving, for that insightful one. So coming from you, one who is, I know you are into this and you have gotten a lot of reports over time concerning mosquitoes, malarias, complaints, and what have you. So what would you advise, or rather, what advice would you give to homeowners in mosquito-prone areas to keep their homes and surroundings clean and free from mosquitoes?
Okay, for the question comes in different folds. So homeowners are in different stratas of our lands. People are in the communities, people are in our urban cities, people are in our semi-urban cities. So different persons have different access to resources, access to materials that help them. But the minimum you can do is to use a treated insecticide net. That's the minimum. Insecticide treated net. So use it to cover your beds, use it to cover your houses. I've gone to communities where I wouldn't say it's innovative in a way, but I saw how families use the treated net to cover the doors. So yes, cover the doors with it, and it stops the mosquitoes from going in. That's perfect People use it to sleep. I've used it to sleep before so many times, countless times.
And you didn't get any skin reaction? Because I know some persons will have skin reactions. I don't know how to sleep in, mosquito nets. So
the treated net has routines for them. So some will tell you sun them before using them. Some will tell you expose them to air before using them. So if you have opened the treated net before, you see the smell that oozes out. And if you go in, it probably might choke you because the essence is not to choke you, the essence is to repel the vectors. Mosquito. Yeah. So in those communities, the best they can do is to change their behaviors, keep your environment clean, ensure waters are not stagnant that breeds the mosquitoes together, ensure you use treated nets, ensure you sleep on long pants, hose and the rest, hose in your legs and the rest of, because in those communities they have high breeds of mosquitoes that can actually infect a lot of people. And mosquito evolve per time. So you might have malaria now, and your white blood cell fights it and suppresses it. The mosquito, the malaria tries to evolve. They call it immolation. So it evolves and gets into another stage where you need serious attention to curb it. So if we can curb it at the little stage it comes, we'll not allow you to get to that pattern. Then if you go to the semi-urban cities where people have access to a bit of finances, you can tell people to start using insecticides to get their environment fumigated and all that.
Thank you.
Yeah. Moving on, so let's look at international collaboration and funding in the fight against mosquito-borne diseases.
So international collaborations have been huge, and some countries are privileged, like Nigeria. And it's also pertinent to note that Nigeria is the highest nation, not actually in funding, the burden of malaria.
Okay.
So if you rank nations that has the highest burden in malaria, Nigeria is number one. So when you come to Africa, Nigeria is the lead. Nigeria takes the lead. So that makes funders focus on key areas that desires their funding, or funding is demanded. So there's a difference between desiring and demanding. So for Africa, the funding is demanded because these people in the communities don't really have access to the good healthcare, access to materials and facilities that will help them prevent or get their health sorted out in terms of malaria and entities. So we have what we call the Global Fund. They are an organization that help fund the national government around circles of malaria prevention and malaria interventions in Nigeria. Not just in Nigeria, all over where they feel the attention is needed. So we have the rollback malaria, they call them the RBM. Then we have also in Nigeria, we have what the organizations we call the malaria consortiums. So malaria consortium also work in communities where they help, they empower communities, give communities a lot of capacities to see how they can prevent malaria and all those interventions that can help subside the effects of mosquitoes on people. So we have a lot of global fundings. I have a lot of partners that are really interested in fighting malaria. And I also need to mention African Leaders Malaria Alliance. They are one of the huge funders of national malaria programs, and they are also where the Malaria Youth Corps fall under, because they felt the need that the government would have been overwhelmed with responsibilities of fighting malaria in communities. So we have communities that have a lot of youth population, and why not us get volunteers in that youth population to drive this community engagement? And that's where we came in. It's not fun. It's not anything funding. It's just passion. We're all volunteers, and we go into communities in 36 states in Nigeria plus FCT. We help raise awareness. We help carry out trainings. We help advocacies and behavioral change programs in communities to ensure these communities aligns to government programs, aligns to government behaviors that would shift the malaria burden away from those communities.
Okay, so have your organization been able to get any maybe partnership or collaboration with the Nigerian government on this?
So as I'm speaking with you currently, 20th of August today, currently we are having the World Mosquito Day at Chida Hotel at Otako, where the DPH, Director of Public Health, National Coordinator of NTDs and Malaria, and the End Malaria Council, Ministry of Youth are also part of the program. So that also shows the relationship that we've built with government agencies and partners in terms of aligning our programs to government programs and seeing that we align together in the fight to end mosquito-borne diseases in malaria and NTDs. So in Nigeria specifically, we have the backings of the government, and we have the leadership or the directives from the government to carry on with the activities that we are doing.
So we can say that the Nigerian government is up and doing, in sensitization, creating awareness, and mobilizing resources for the prevention of mosquito-borne diseases.
With the mandate, yes, with the mandate of the new Minister for Health and the agenda for the Ministry of Health, in partnership with other development partners, organizations, they have had strong relationships and strong desire to end malaria and entities in Nigeria. So the Nigeria government is fully and passionate about the fight, and that's why they allowed youth to come in. And there are so many innovations that are coming in that are supposed to be rolled out, today being the World Mosquito Day, or subsequently when they feel the need is there for them to roll it out. They're also having media engagement for media partners to sell the awareness to different communities and different places in Nigeria. Nigeria government is fully committed in the fight against ending malaria and NTDs.
Okay, so now let's look at your firm, Malaria and Neglected Tropical Diseases Youth Corps. So what are the tropical diseases that you believe are neglected in Nigeria?
Okay, we have a lot of neglected tropical diseases in Nigeria.
Such as?
So, okay, I am not an expert in it. Okay. So that's why I came with an expert. But we have trypanosomiasis and the rest of them that happens or people get affected with in communities.
Okay.
So all those infections that happens to people due to NTDs and malaria are what accumulates into the youth corps fighting in the communities.
Okay.
Thank you so much, Mr. Gibbon Promise, for being on the show today. Quite a very interesting one from you. I love the fact that, you are there to help us chase the mosquitoes. Chase the mosquitoes away.
Actually.
Thank you so much for coming, and then we'll hope to see you very soon.
Thank you so much.
You're welcome.
All right. So we wrap up our comprehensive discussion on the World Mosquitoes Day. So much you have learned. I trust I've learned a couple, on staying safe and being intentional about my environment and what, those tiny creatures, I call them tiny creatures, mosquitoes can do to my health. All right. So Memuna, as we wrap up.
Yes, okay, you said it also. I don't need to, to add up anything, but just stay safe. Make sure you live in a very clean environment. Be clean, most importantly. It's the raining season, okay? So, and mosquitoes breathe in water, am I correct?
Yeah,
yes, they
correct.
do. So just keep your environment safe.
Stay in treated nets.
Okay, stay in treated
and don't
nets.
self-medicate.
That's very important. No self-medication, please. When you feel any symptoms, please go and see a doctor, run a test, and then you get the proper medication to be fine. We'll see you tomorrow. Thank you so much for watching the Good Morning Africa show. I am Imana Bagodo. Enjoy the rest of your day.
Don't forget to follow us on all our social media platforms on Housing TV Africa. We'll be here same time again tomorrow. Stay safe. I'm Joyce Somoso. Bye for now.
Housing TV Africa, your first in housing news.